Peptic ulcer disease or PUD. A peptic ulcer is an erosion in a segment of the gastrointestinal mucosa. We can have the stomach ulcer or the duodenal ulcer. Common symptoms of peptic ulcer disease include fatigue, nausea or vomiting, dull stomach, burning or ache, gas and bloating, and loss of appetite. The causes of PUD. H. pylori infection is a major cause of peptic ulcer disease. NSAIDs such as aspirin, diclofenac, brufen disrupt the normal mucosal defense and repair, making the mucosa susceptible to acid. Cigarette smoking impairs ulcer healing and increases the incidence of reoccurrence. Zolliger elution syndrome is a hypersecretion of gastrin. H. pylori is a spiral-shaped, gram-negative organism that has adapted to thrive in acid conditions. In developing countries, it commonly causes chronic infection and is usually acquired during childhood. The organism has been cultured from stool, saliva, and dental plaque, which suggest oral-oral or oral-fecal transmission. Infections tend to cluster in families and in residents of custodial institutions. Infected people are 3 to 6 times more likely to develop stomach cancer. Preferred tests for the initial diagnosis of Helicobacter pylori include the urea breath test, whereby an oral dose of 13C or 14C labeled urea is used. In an infected patient, the organism metabolizes the urea and liberates a labeled CO2, which is exhaled and can be quantified in breath samples taken 20 to 30 minutes after ingestion of urea. Sensitivity and susceptibility are more than 95%. Urea breath tests are well suited for confirming eradication of the organism after therapy. Stool antigen analysis. They have a sensitivity and specificity similar to that of urea breath test, particularly for initial diagnosis.